Of course, as I told you, there were many concerns raised by the community members, the elders, the Grand Council, and the Cree Health Board. And this just lists some of the key points. So, of course, safety issues, as I told you, neither the clinical scientists nor the elders or anyone wanted anyone to be harmed in this project. So safety was a major issue. Of course, the use of AU knowledge without consent. So this is abuse of or misuse. Obviously, ownership of intellectual property was one of the concerns. The partnership between the elders and ourselves, and the misuse also of medicine by others. And this is more of in terms of a health concern. So using the medicine not under the supervision of the elders or of health professionals. Better by the elders because they're the experts in the traditional medicine, obviously. So what happened? Well, of course, the project started in 2003 before the agreement was signed. It took 5 years of negotiations to come to an interim agreement just at the level of the University of Montreal. And I'm glad that we took this approach because if we had dealt with the 3 university research offices at the same time, it would have been a nightmare. So we took the approach of setting down a first agreement with the University of Montreal that everyone could live with. And actually, we all signed it each individually as an interim agreement. So we personally, just to show the communities that we were serious in abiding by this. And actually, as stated here, we always acted as if the agreement was in force way back from 2003. And I think Brian can attest to that. And all of the researchers are very great people in this. It took 1 other year to get the agreement to go through the research offices of the 2 other universities. But this led to a better agreement. And if anyone's interested, we have the agreement online. It's on our website. It's a 50-page document, but we also made a lay language summary, which is available. It's it's French, English, and 2 dialects of Cree in the syllabics. And if you want, I have some copies, paper copies in my office. Just email me and I will be glad to send it to you. So the parties to the research agreement are the 4 AU communities that I mentioned, and there will be 2 additional ones on their way. The Cree Board of Health and Social Services of James Bay, the 3 universities that I mentioned, Montreal, McGill, Ottawa, and also Marc Prentke is working at the Université de Montréal Hospital Research Center, so they are also party to the agreement. The very important principles of the agreement is obviously confidentiality and AU control over the traditional knowledge. Every publication, before we can submit a publication to a scientific journal, it goes through a formal review process. It's made the research is summarized into a lay language, translated into Cree, submitted to the elders who participated in the study concerning this plant. That's the object of the paper. And they either give us a go or they ask us to change things if they think that there's any threat to the traditional knowledge. We do this in a very collaborative way, and there are many mechanisms, and I will explain this in a second. In terms of intellectual property, there was a model of joint ownership that was developed because, of course, we wouldn't have looked at these plants if the healers hadn't shared their knowledge with us. But of course, the Cree wouldn't have done all the work, the lab work and the scientific intellectual property that we have. So it's really a joint intellectual property, and this went over very well. And of course, we have all as many forms of benefit sharing that I can detail in the question period. So in conclusion, then, I hope I showed you that our in vitro bioassays are good tools to screen, to pick up potential plants that have some activities. That we are not a drug discovery program. This is very important. That ethics plays a major role. We work with the utmost respect for the Cree culture and knowledge. And I didn't tell you this, but even when the students go out to collect plants with the elders, we do try to follow the Cree way. So we give some gifts of tobacco, and so we try to be as culturally adapted as possible. we act in full transparency about the project. You know, a lot of the research with Aboriginal health is what I heard called the helicopter research. So they helicopter in, do the research, helicopter out, and they never hear about the researchers anymore. Well, we have, every 6 months, we have, since 2006 at least, we have meetings where the elders are with us. We, again, prepare lay language summaries, translated into syllabic and Cree, and they sit with us when we present the updates of the data, the work that had been done in all of the laboratories every 6 months. And we give them nice little booklets so that they can keep track of what's happening. And there's really sharing, it's really a two-way street. So they have been very important to guide us in our projects. We listen to them a lot, and I think we paid attention to keep them in a central role. We have a steering committee that meets by telephone conference every month, and it's made up equally of Cree and academics. Of course, we protect, as I showed you. And honestly, when I started this project, I came with my big scientist boots. Here I was trying to validate traditional medicine. I've been humbled a lot by interactions with the elders. I've grown personally, I can tell you that much. And I see myself much more as a knowledge translator now, taking traditional knowledge and translating it into scientific language that the health professionals can understand. And this, I hope, will help to get them to accept that Cree traditional medicine be used by Cree diabetics. And the proof is that we're doing this clinical study that I mentioned. Again, we identify these as active compounds more for quality control or characterization of the traditional preparations. And we use an evidence-based approach. Of course, these are all nice keywords that the funding bodies like to hear. So, we're aiming for consistency, clinical efficacy, safety, caring about herb-drug interactions, and etc. So, of course, I'm only the spokesperson. My own lab has many talented people, and I'm really proud to show this picture. This is the last August in Mysticity, and if I could show you these pictures year after year, and it has grown. And there were over 100 people, and I'm really proud to say that I would say more than 60% were from the Cree communities themselves, and the Cree Health Board and all of these. So, of course, I have to thank CIHR and the Natural Health Products Directorate for the funding, and also the public agency for the clinical studies. And miigwech. Thank you very much.